Help is on the way for the St. Johns County Fire Rescue Team in the middle of what some are calling a mental health crisis. According to the CDC, EMTs are nearly 1.5 times more likely to die by suicide than other members of the public. First responders are more likely to die by suicide than in the line of duty. Digital reporter Travis Gibson is joining us now. The county now putting more money toward mental health support for first responders there.
Yeah, Ken, St. Johns County Commissioner made an emotional plea for first responders who are repeatedly exposed to dramatic events in their work. And her fellow commissioners responded with $500,000 in new funding.
Gentlemen, my fellow commissioners, our men and women in fire rescue are in crisis.
St. Johns County Commissioner Sarah Arnold made an unexpected and passionate plea for increased mental health funding for St. Johns County Fire Rescue. Arnold cited statistics saying depression is 5 times more likely for firefighters than the rest of the population, and suicide is the leading cause of death among firefighters and EMTs.
They always show up when called, and they never let us down. But I have let them down. We all have let them down.
Arnold implored the commissioners to approve $500,000 in new funding for the department to go towards mental health. It was an ask that was quickly and unanimously approved. St. Johns County Fire Rescue spokesman Jeremy Robshaw said his department is grateful.
We recognize, I think, first responders nationally, not just firefighters, police officers. There is a mental health crisis, and we've got to take care of our people.
Robshaw said the money will go towards hiring a full-time chaplain who is also a firefighter or paramedic. Fire Rescue will also contract with a professional mental health service that can provide counselors after traumatic events. Robshaw said it's all part of a new mentality for first responders.
Yeah, I think there's obviously was the old way that it was dealt with, and that was differently than what we recognize today as the way we probably need to be dealing with it. And that's being open and honest about what we're seeing and managing. I think that you look at people who have been in this career a long time, certainly those who have had past experience, whether they're veterans, it just starts to compound.
Now, anyone who is experiencing emotional distress or a mental health crisis can call the new national hotline at 988. We also have a list of mental health resources inside this story on news4jax.com. Kent, Joy.